Recurrent frontal and sphenoidal fungal sinusitis treated without oral steroids by steroid impregnated Nasopore and itraconazole. Polypectomy somewhere in South Tamil Nadu. Then she came to me with orbital involvement. I did radical endoscopic sinus surgery, and the patient was fine with a good follow for 7 years. She lost follow for 1 year, and she came back with this CT scan picture of recurrent fungus and polypoidal mucosa in both the frontal sinus and both sphenoidal sinus. Even the rest of the ethmoids, which have been operated well, and maxillary sinus are fine. The frontal recess is wide open, still there is fungus, and you can see the allergic mucin being sucked out, and you can see even the fungus in the sphenoid on the left side. This endoscopy was done on the OPD. I tried to remove maximum allergic mucin in the OPD. She has diabetes and on medication and under good control. When I told her to start oral steroids, she was very apprehensive and was reluctant to take oral steroids since she's a diabetic. She had some knowledge about all these things because she's a school teacher. This is some allergic mucin from the sphenoidal sinuses, and you can see edematous gobbler mucosa in sphenoid and frontal recess areas. This is on the right side. You can see edematous mucosa, mucopollen discharge everywhere. So the idea came to me was triamcinolone acetate local application, that's Kinacort. So I used Nasopore, 8 centimeters pack, cut into 2 pieces, and use since the patient doesn't want to take oral steroids. I applied this Nasopore bits and dipped in triamcinolone acetate, 2 ml, 1 ml for each side, and kept on the first day and on the 7th day. And I started the patient on itraconazole 100 milligrams BD for the 15 days, along with antihistamine and mucolite. Just applying the Nasopore dipped in triamcinolone acetate, each side 40 milligram, that is 1 ml. I did this procedure on both the sides on the first day as well as on the 7th day. This is the tip going into the sphenoid sinus all along the roof till the frontal recess area. It sticks and stays there unless you blow the nose very violently. Patient doesn't hardly feel the pack inside the nose. It doesn't give any irritation or compressive feeling, but since it doesn't swells like the Mirocell, and it usually dissolves by 5 to 7 days, and it disintegrates into CO2 and water, so it is not toxic at all. When I reviewed the patient on the 7th day, the Nasopore has disintegrated completely. I did a suction and again did the same procedure again. I reviewed the patient on the 15th day. I took the CT scan. This is a picture. All the fungus has gone. Mucosa, edematous mucosa has subsided. You can see the clear frontal sinus with very wide opened frontal recess. The findings of the previous surgery, which I did 8 years ago when I was working in Chinnamalli India Hospital. This patient had an absent middle turbinate, lost both sides during the previous septoplasty and nasal polypectomy surgery in the South Tamil Nadu. You can see even the sphenoidal fungus all gone, the edematous mucosa well subsided with the topical application of the steroid impregnated Nasopore along with itraconazole for 15 days. This is the endoscopy on the 15th day. You can see no discharge, no crus, no allergy missing anywhere. You can see all the cavities, maxillary sinus, sphenoidal sinus as well as the roof, frontal recess all clear. This with a 45-degree endoscope I am showing the frontal recess, that's anterior skull base, that's a frontal recess. This case, this left frontal sinus being communicated with the right frontal sinus. You can see that area also. And the mucosa is almost near normal. This is the endoscopy on the right side. Again, you can hardly see any discharge or any edematous mucosa. So in patients whom we can't use oral steroids, or patients doesn't want oral steroids, steroid impregnated Nasopore does a good help. This has been even published by Peter Catalano in a couple of studies.